So good morning, everyone. This train is going to run on time all day. So I'm Richard Bonney from the University of Virginia Schools of Law, Medicine, and Public Policy, and it's my privilege to be the chair of this study. I'd like to welcome everyone here on behalf of the committee and the National Academies of Science, Engineering, and Medicine. Our assignment is to inform the U.S. Food and Drug Administration, the sponsor of the study, as to the state of the science on pain management and prescription opioid abuse and misuse, including a characterization of the evolving role that opioid analgesics play in pain management. Based on a review of the evidence, the report will make recommendations for action that the FDA and other organizations can take, with a particular focus on those actions that FDA itself can take to address the prescription opioid overdose epidemic while taking into account the needs of pain patients. A particular focus will be actions FDA can take as part of its development, review, and approval of pain medicines, as well as its activities aiming to encourage the safe use of these medicines. A full statement of the task for the committee is available in the meeting handouts. This is the first of two workshops that will be held by the committee. This workshop is intended to inform the committee's work related to the first four bullets in the statement of task, if you have it before you, namely, updating the state of science on pain research, care, and education since the 2011 report by the Institute of Medicine, Relieving Pain in America. Reviewing the available evidence on best practices with regard to safe and effective pain management, characterizing the epidemiology of the prescription opioid epidemic, and identifying research questions to assist FDA in developing a framework for opioid review, approval, and monitoring. The committee's second workshop, which is scheduled for November the 4th, will address the fifth bullet in the committee's task, the identification of actions that can be taken by FDA and others to address the opioid epidemic. So I'll give you a little roadmap about what we're doing today and kind of what the ground rules are going to be. The committee's, our agenda is divided into 5 sessions. In the first session, we will hear the perspectives of invited experts on progress and future directions in clinical pain management and provider education, while the second session will focus on perspectives on progress and future directions in basic pain research and the development of new analgesics. After that, we will have a brief period for public comments and/or continued discussion of the morning sessions. That will be then followed by lunch. We will break for lunch at 11:45 and resume at 12:30 for the afternoon sessions. Those sessions will focus on trends in the harms and consequences of prescription opioids and on the interventions that have been taken to reduce opioid-related harms. We will conclude the day by hearing from representatives of stakeholder organizations who will reflect on the day's presentations from their perspective and describe what they view as promising ideas and interventions and remaining critical issues. We will avoid promptly at 4:30 because there would be another event here thereafter. For each session, we will hold off on questions and discussion until after the panelists in each session have given their presentations. Because the workshop is being recorded and will be transcribed, and during the discussion sessions, we will ask that anyone that is participating in the discussion go to the mics, state your name and affiliation before giving your question or comment. During those discussion sessions, we will first invite questions and comments from the members of the committee, and then take questions and comments from public attendees, time permitting. I want to emphasize that this, of course, is an open and on-the-record session. Interested individuals and members of the press have been invited to attend as observers. But of course, this is not a news conference, and we will not be entertaining questions from the floor other than the comment periods that I've just mentioned. Any reporters who are attending who would like to talk with members of the committee are kindly asked to touch base with Molly Gavin, the media officer with the Academies. Molly, are you there, just in case anybody wants to know who you are? There. I would also want to emphasize that this is an information gathering session for the committee. The committee has just really begun. This is our second meeting, and we're in the process of assembling information and material, and we'll examine and discuss what we've heard today in the course of making our findings, conclusions, and recommendations. But that process, as I've said, is just underway. Therefore, I hope everyone will be mindful of the fact that the committee has reached no conclusions and that any comments or discussion that we have and questions that are posed are not meant to signify any particular point of view about about the committee's findings and conclusions. In addition, committee members typically do ask probing questions in these sessions, and that also, of course, is not to be indicative of their personal views. The committee will deliberate thoroughly before writing its draft report, and once the draft report is written, it must go through a rigorous review by experts who are anonymous to the committee, and the committee then must respond to this review with appropriate revisions that satisfy the Academy's Report Review Committee and the President of the National Academies before it is considered as an official Academy's report. So as I said, we're at the beginning of a very long and challenging but important journey, and there's a lot that needs to be accomplished. All right, so that is essentially where we stand, what the purpose of the committee is. I'd like to invite Dr. David Clark, who will be the moderator for the first panel.